Bosworth offers the widest selection of economical and fully functional temporary polycarbonate crowns. B-crowns provide an appearance as natural as the patient's own teeth. B-crowns bond readily with all types of self-curing resins and all composite materials. B-crowns are available in a wide selection of anterior and posterior sizes for greater selection. The following presentation demonstrates the use of Bosworth B-crowns with Bosworth's Trim PEMA temporary crown and bridge material.
Hi, I'm Dr. Rick Bonell. We are going to demonstrate the use of Bosworth B-crowns and their Trim and Trim 2 products in order to construct a temporary crown on prepared tooth for a crown. You find a size that's compatible. Fits in rather well. It's a little tight, but that could be trimmed and adjusted without perforation of the shell. So we gently remove a little bit of the material and we fit it again. And now it goes down much smoother. Now I feel I have the height rather well. I like the way it's trimmed down. What I then do is roughen up the outside area just a little bit so the trim material that overflows will chemically as well as mechanically lock in a little bit better. I now have the temporary pretty much prepped the B-crown. The tooth has been cleaned off by the assistant. We now need to lubricate it so that the material does not stick to the prepared tooth. We are using acrylic, therefore if there is a composite buildup, it will not bind anyway. I am using the Mask Silicone Lubricant by Bosworth. I like to thin it down, and I like to use my air syringe to super thin it. I don't have it in the lab here. And make sure it gets into every porosity, into the so-called circular area, and any undercut there may be on the adjacent teeth, because we do not want to lock it up. With that done now, we'll use the trim and the easy pipette type of deliverer and place some of the liquid in a dampened dish. I am using the Trim 2. The difference between the Trim and the Trim 2 is basically there's multiple shades. Although there is a universal shade on the B-crown, it can be altered somewhat by the different shades of the Trim 2. I then apply it within the dampened dish. How much to apply is when it slowly is absorbed the powder by the liquid. I'll then moisten all the particles. Add a little bit more. I do not want it gummy at this time. I want it to be able to flow into the B-crown and not trap any air. Then just leave it to the side and have it flow in nicely. So I'm not trapping any air because there will have to be adjustments on the occlusion, and I don't want to perforate this shell and have a void and have to redo it. In a tooth that's a little longer, a patient that's had gingival recession, periodontal surgery, or it's a dental implant, and I'm doing this, I may make this a little runnier so it flows down nicer. And then to increase the setting time and the thickness, I may just add a slight powder on the top. And you can see it's being absorbed. So now I fill it, a little bit overfilled perhaps. I'll take a little out. We now go to the prepared tooth and gently guide it on. We now wait for it to set up and cure. Depending on the tooth, if it's a live tooth, a non-vital tooth, dental implant, and the position in the mouth, the thermal setting is different. And then we'll attempt to pull this off. And it comes off nicely. You can see where the overflow is. Because we roughened up the borders of the B-crown, it is now bonding nicely. Trim and trim 2 is designed to chemically bond with the B crowns. Okay, we've let several minutes pass, and we have now had the B crown with the trim reline harden. Take it out of the cup of warm water, and you can see it is firm, it is hard, it is not being displaced. I do not try it on the prepared tooth at this time because it may get wedged in. When we removed it originally, it was rubbery. So we now trim it. The margins are able to be seen. And we gently go with a fine finishing burr, smooth it down, and trim off the excess. Then clean it out, remove the excess material. And now we go back to the tooth in the mouth and we try it on. And now we're seeing we have a pretty good fit. You can see the gingival line, margin fits pretty good on the buccal and on the lingual. Go with the Explorer to make sure it is fitted right. If it's overhung, we want to reduce it so we do not cause any gingival irritation. Now if I'm happy with the way it fits, at this time now I would remove, just twist off the little label listing the size of the B crown, and I will then gently just smooth it down a little bit. I will place it back on the tooth, and then with articulating tape check the occlusion to make sure it fits properly. Take a look from the side, make sure the smile line looks good. If I want, I could do a little bit of an adjustment. Now at this time, to prepare it for cementation with temporary cement, I then have my assistant use either hydrogen peroxide or a diluted mouthwash and gently clean off any lubricant that's left on the tooth and the adjacent areas that may hinder the cementation of the temporary. At the same time too, I would have them go with some soapy water just to clean out the temporary crown to get any lubricant off so it doesn't hinder the cementation. There's several ways to polish these. I have times tried to use an acrylic polishing rubber wheels. Sometimes it gouges it. I have found out the easiest way to do it. I could see another patient, and I have my assistants go with either pumice and a Profi cup or use Profi paste to gently polish it all down. We then place it in ultrasonic to get it cleaned off good, disinfect it. It is then ready to be cemented into the patient's mouth. It is then cemented, excess cement's removed, and the patient can then leave with something in that open space.
For more information, contact the Bosworth Company or your favorite distributor.